Hello everybody, welcome back to Doc Shala. So today our topic of discussion will be AAE Diagnostic Terminology. So we have discussed what is AAE in a previous video. It is nothing but American Association of Endodontists. So now let us look at a question from Dental Dex. The question is, which of the following is an inflammatory reaction to pulpal infection and necrosis characterized by rapid onset, spontaneous pain, tenderness of the tooth to pressure, pus formation and swelling of the associated tissue. So these are the signs and symptoms that we are seeing it. It is an inflammatory reaction to pulpal infection. We can see the necrosis of the tooth. The pain is rapid on onset and it is a spontaneous pain, and the tooth is tender to pressure, pus formation is seen and a swelling of the tissues is associated. So the options given here are: is it asymptomatic apical periodontitis, is it acute apical abscess, is it chronic apical abscess, or is it asymptomatic apical periodontitis. So let us now look at a few important terms associated with diagnosis in endodontics so that we can arrive at an answer for this question. So it is the first one we will see is normal apical tissues. So the normal apical tissues are teeth with normal periradicular tissues that are not sensitive to percussion or palpation testing. The lamina dura surrounding the root is intact lamina dura, and periodontal ligament space is uniform. So you can observe that from the radiograph here. You can see the lamina dura which is surrounding the tooth is intact, and the periodontal ligament space is uniform in the teeth. Asymptomatic apical periodontitis. So what is asymptomatic apical periodontitis? It is nothing but inflammation usually of the apical periodontium, producing clinical symptoms including a painful response to biting or percussion or palpation. It may or may not be associated with apical radiolucent area. So in this radiograph here we can observe an apical radiolucent area surrounding the tooth, but it may or may not be present in a symptomatic apical periodontitis. This is not necessary. Okay, apart from this, what are necessary? Symptoms such as painful response while biting, percussion or palpation are necessary. Okay, along with that we can just take one more symptom as a one more sign as a diagnosis for symptomatic apical periodontitis, that is mobility of the tooth. Okay, we normally in clinical situations we check for the mobility of the tooth. If the tooth is mobile and the radiograph is showing this kind of radiolucency, or if it may or may not be present, even if radiolucency is present or may not be present, we can just observe some inflammation of the tooth in the patient's mouth. Then we can arrive to the diagnosis of symptomatic apical periodontitis. This is just the recall radiograph after 3 years. You can just observe that the inflammation is subsided. Okay, then asymptomatic apical periodontitis. So since it is asymptomatic, we cannot see any symptoms, right? So how we will diagnose it? The inflammation and destruction of apical periodontium, that is of pulpal origin, appears as a apical radiolucent area. So here the apical radiolucent area is the key for the diagnosis. In symptomatic apical periodontitis, we may or may not see apical radiolucent area, but we'll definitely see mobility of the tooth. Okay, and does not produce any clinical symptoms. So clinical symptoms are not produced. So remember, mobility is the sign that a clinician identifies. It's not the sign, it's not a symptom that patient tells you. But sometimes patients may also tell you that this tooth is very painful and it is mobile and all. But yeah, you need to be very careful while diagnosing between asymptomatic and symptomatic apical periodontitis. We know that we observe PDL, like periodontal ligament becomes wide during periodontitis. So those kind of signs, and along with the symptom of pain on percussion, will definitely arrive to the diagnosis of symptomatic apical periodontitis, whereas this patient with asymptomatic does not experience any pain, but we can see the apical radiolucent area like this on the radiograph. Okay. Then coming to acute apical abscess. So acute apical abscess is when an inflammatory reaction to pulpal infection and necrosis, which is characterized by rapid onset and spontaneous pain, tenderness of tooth to pressure, pus formation, swelling of associated tissues. So all of this is seen in acute apical abscess. So you can see the abscess that is shown here. So here you can observe the abscess of the tooth, right? So in acute apical abscess, you can see a rapid onset of pain. Suddenly the patient experiences the pain. Suddenly it arrives in a huge amount, and the tooth is tender to pressure. Even if we tap the tooth with our mouth mirror probe, the tooth is tender to that pressure. We can see the pus formation and also swelling of the associated tissues, right? But what we cannot see here is mobility, right? Mobility is not there. Okay, this is a simple logic people use, like clinicians use when they want to differ between symptomatic apical periodontitis and acute apical abscess. So rather than that, you can just take it as a normal sign. Okay. Then chronic apical abscess. Chronic apical abscess is an inflammatory reaction to pulpal infection which is gradual onset. So chronic, of course, it is gradual onset, little or no discomfort, intermittent discharge of pus through a sinus tract. So you can observe the sinus tract here that is producing pus. Okay, it develops over a period of condensing osteitis. So this is complete different entity from all that we have seen till now. It is a diffuse radio-opaque lesion representing a localized bony reaction to a low-grade inflammatory stimulus, usually seen at apex of the tooth. So we can see the osteitis like a bone formation, like it is a radio-opaque lesion. It looks like bone, right? It looks like some bone that is condensed gradually. So it is seen in the apex of the tooth. So this is condensing osteitis. It can be diagnosed easily, right, on a radiograph. So let us come back to the question. So in our question, the tooth has a pulpal infection, necrosis, rapid onset, spontaneous pain, tenderness, pus formation and swelling of associated tissues, which we have seen in our previous slides. It is acute apical abscess, right? If you like our video, do subscribe to our YouTube channel. You can also follow us on our Instagram handles at Docshala for our dental content and at Docshala Medical for medical content. You can also find us on Telegram. Thank you.